Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 12, 2025. This is a video on an article published in European Heart Journal, May 2025 issue, titled Ablation of Atrial Fibrillation, Brain Glymphatic Function and Cognitive Performance. There's an accompanying editorial by Dr. Jared Bunch from Utah in the same issue of the journal. Atrial fibrillation is linked with cognitive decline and dementia independent of stroke risk. The brain glymphatic system, driven by heartbeat-induced arterial pulsation, facilitates CSF or cerebrospinal fluid clearance. Atrial fibrillation may impair glymphatic function, leading to cognitive dysfunction. This study investigates the relationship between atrial fibrillation, glymphatic function, and cognitive performance. Prospective case-controlled study with 87 atrial fibrillation patients with 44 healthy controls. The brain glymphatic activity was measured using an MRI technique called DTI-ALPS or diffusion tensor image analysis along the perivascular space. Cognitive function was assessed with neuropsychological tests. Ablation therapy was performed in 50 atrial fibrillation patients with MRI pre and post ablation. What did they find? Atrial fibrillation showed significantly lower glymphatic activity compared to controls, p-value 0.016. Non-paroxysmal atrial fibrillation patients had the lowest glymphatic activity, p-value 0.002. The lower glymphatic activity correlated with poor cognitive scores. Ablation improved glymphatic activity, p-value 0.015, particularly in those with a short duration of atrial fibrillation. The key takeaway: impaired glymphatic function mediates atrial fibrillation-related cognitive decline. Catheter ablation may restore glymphatic activity, highlighting importance of early intervention. Findings support the potential rhythm control for protecting cognitive function in atrial fibrillation patients. The accompanying editorial critique highlights the potential link between atrial fibrillation, impaired glymphatic function, and cognitive decline. Atrial fibrillation is associated with cerebrovascular dysfunction, which may impair glymphatic flow, accumulating neurotoxic products like amyloid beta. Catheter ablation may restore cytothrombotic rhythm and improve glymphatic clearance. The critique: small sample size limits generalizability. The MRI index, is not the gold standard for glymphatic function assessment. Unclear if AFib burden and heart rate variability influences glymphatic function. Further randomized controlled trials are needed to establish causality. The key takeaway: this study paves the way for future research, but requires validation with robust methodology. Personally, I've always felt that the dementia associated atrial fibrillation is probably due to microemboli from the left atrial appendage going to the brain. And anecdotally, I've seen patients who stop their blood thinners are more likely to get cognitive dysfunction. However, this study clearly shows that there are other mechanisms to explain it. There was a recent article in Cell Press, which was open access, where I've done an earlier podcast talking about glymphatics and meningeal lymphatics and the brain immune code. Podcast brought to you by Master MedFacts at mastermedfacts.com.